Hello, hello. welcome, y'all. It is Nurse Jazz, and we are in the building today. And I just wanted to come on here for a little bit and discuss a couple of things. And first and foremost, big shout outs to Tartar. Her name is Tara Woods. She won the Spring into My Summer Body Challenge last week, and she won the pot of money. And God bless her. She wanted me to excuse her absence for today. She really wanted to be on, but she couldn't make it here today. So, but we thank you, Tartar, for participating and being a part of the challenge and really, crushing some goals along the way. So we thank you, Tartar. Tara is like one of the most active people I know. She always wants to walk somewhere. She literally just texts about doing jump rope and, figuring out when we're going to get back into roping. Double Dutch and stuff. So she is definitely one of the most active people that I know. Every time when no one feels like walking, here goes Tara. So, but today, I definitely wanted to get into mental health. It is Mental Health Awareness Month. So I definitely wanted to come on and discuss a couple of just the top three most common mental health illnesses. I am not a psychiatrist. I am not a psychologist. I am a primary care provider, but let me tell you, I'm not going to say everything because some stuff is genetically linked. But when I say a lot of illnesses, primary care is rooted in mental health, I cannot make this up. And I always look back at like what I thought when I was going to be a nurse practitioner, like, oh, because psych was one of my hardest subjects. And I'm like, you know what? Everybody that have mental health, I'm referring them to the psychologist or the psychiatrist or the therapist. Like, I'm just referring them. It's impossible. It would have been impossible for me to, for one, who's going to see them, because the mental health, appointments, and they're just overwhelmed after the pandemic for sure. And it's impossible for me to separate the two. It's impossible for me to separate a mental health diagnosis from a an actual medical diagnosis that doesn't have anything to do with mental health. So anyway, so I definitely wanted to get into the top three. And the top three mental health illnesses are anxiety, depression, and PTSD. So I just wanted to break down some of them because, you know what, honestly, some people don't even know that that's what they have. They don't know that they are depressed. They don't know that they're anxious. They don't know they have PTSD because it's something that people just live with, and they've been probably living with it for most of their lives. And something probably sparked, them having, like realizing it or like making it worse or something like that. But people live with it, so I definitely wanted to just kind of describe what they are. And I'm going to start with anxiety. So anxiety disorders are characterized by underlying feelings of extreme fear or worry. And in this group of conditions is generalized anxiety disorder, panic disorder, social anxiety, and other phobia-based anxieties. Okay? So how I can tell that somebody is a provider, Yeah, yeah. So somebody says, so true. I didn't know I had PTSD. So as a provider, how I know that somebody is anxious, well, a lot of times people come in and they don't say, I'm anxious, right? I have to kind of like figure it out. So sometimes it presents and they say, oh man, I can't sleep. My mind just keeps going. Or they say, oh, I'm always tired. Or I'm scared to do this, I'm scared to do that, and they just have this prolonged sense of like fear and like nervous all the time. And it comes through conversation, right? Like, or I'll ask specific questions, but a lot of times that's how it presents itself. So if you have a sense of extreme worry, extreme fear, or something, you just always constantly, your mind is always going, or you always have this you always like it's you always thinking like you always thinking the worst, or you always have to try to figure out what this next scenario is and stuff like that. That can be anxiety. And then ways that people, kind of figure out that it is that they have these panic attacks. And panic attacks can make you feel like you're about to die. Seriously, people end up in the hospital and they are getting all of these tests ran and it comes back nothing. And as soon as that somebody say like, well, what happened? Like, did something happen? But you just can't rule out, just, oh, this panic attack. It's kind of like one of those things that is, we rule out everything else and then like, oh, well, probably panic, and a lot of that comes from anxiety. It comes from extreme anxiety that you then start getting these somatic, symptoms of like these physical symptoms of can't breathe, heart racing, chest pain, all of these things, and it's all mental. Okay, so again, as a disclaimer, disclaimer, I am not diagnosing. I'm just literally educating. So please don't say Nurse Jazz said that I got. No, I didn't. I'm just saying it is a possibility, and I'm giving you education to then go to your primary care provider or your healthcare provider to, see if this is something that you're dealing with. Okay. So all education based, y'all. Okay. All right. So ways that anxiety is treated is, of course, medication, or psychotherapy. So what I also wanted to talk about is that we have to break the stigma of like, oh, you're crazy if you go see a psychiatrist, psychologist, or a therapist. I am definitely a patient of therapy. I attend therapy on a regular basis. And I want to say that I pretty much have a sound mind, that I'm pretty, I live my life on the straight and narrow, and I'm not trying to go and do nothing crazy or anything like that, or have any kind of suicidal thoughts, or I'm not that, excuse my phone, y'all. But you know what? You have to have a mental check-in just as much as you have to get a checkup physically. You have to have a mental check-in. You will go around thinking that how you deal with things is not saying it's completely wrong, but is it a better way? It possibly is. It's possibly a better way to handle, how you handle things, right? And then honestly, listen to your family, y'all. If your family is telling you like you need to relax, you always overthinking, you need to say no, you need to like listen to your people. They usually have your best interests at heart. Okay, so just listen to your peeps. So the second most common mental illness is depression. So, and they go on to say, and which I learned in school, like is very misunderstood. Like they just kind of like write it off as like, oh, they're just sad. But it's more than that. It's more than that. And it's a much longer lasting effects than just somebody having a bad day. So usually it's an individual must have experienced a depressive episode that lasts more than 2 weeks. And that could be exhibited through feelings of hopelessness. So a lot of people just like, oh, it's just never going to change. And oh, this is just the worst ever, and just has no hope or no faith in anything ever getting better. They think that this one season is going to last forever. And if I can encourage y'all, every part of your life is a season. Some just last longer than others, but every single part of your life is a season. I promise you, if you grab a hold of that, you will understand that you just have to take what you can get from a season and take the good, leave the bad, and anything that, won't harm you to the point that you're not here, it's going to be a lesson, right? It's a lesson in everything. So anyway, going back, that it is through feelings of hopelessness, a lack of energy, and thoughts of death and suicide. So people that, again, going back to that, I'm just hope, I don't have any hope, and it's just, I might as well not be here anymore, or I might as well, my family would do better off without me. Things like those kind of thoughts. It's a sense of just, it's episodes of sadness, and things trigger these things, right? Like, people lost a lot of people over this pandemic, and then some, right? So it's not saying easy, but I, as a provider, I understand how you can feel like that way, because at a time we didn't know what the heck was about to go on, right? Like, the whole world shut down, the whole entire world shut down. And we didn't know if we were exposed. I mean, during that time, we didn't even have tests for everybody. And, the only thing that was on the news was people dying. They telling you to stay in the house, but you can go get food, people getting COVID from the market. And then there's people that's bringing COVID in the house, and grandma passing away. I mean, you name it, it happened. And then on top of that, it was unemployment. I mean, you can have, these thoughts are definitely valid, but are they to the point that you should believe these things, that you're no longer supposed to be here anymore? Absolutely not. Please don't take your life. Please don't take your life. You woke up today. It is a reason that you woke up today, and you have some more work to do today. Okay. The reason why you're here, maybe we didn't figure it out yet, but we need to figure it out at some point, but not today. We are not taking our own lives, y'all. Okay. If I can encourage somebody, you have so much more to offer than what you think. And if you can get deep in yourself and just look at yourself and love yourself, how our Creator, how God loves us, you will understand. I mean, He understands the most inner part of you, and still woke you up today. I mean, all the bad thoughts, all the nastiness of you, all of that stuff, and He still woke you up today. How dare you? Do not take your life. You have so much more to offer. Okay. So suicidal thoughts, homicidal thoughts, thoughts, try to, come on, y'all. Like, we have so, and then let me talk to us Black people. And I'm going to say this, and then I'm going to leave it alone. We worry so much about all of these things, and, oh, this person looked at me wrong. Oh, they got my girl. Oh, they, I don't know, stepped on my foot. Oh, they cut me off in traffic. Y'all, I promise you, it is so much more to worry about than those minuscule things. Like, come on, y'all. Like, look at the bigger picture. I promise you that we need not to be like competing against each other. We need not to tear down each other. We have a lot as Black people. We have a lot more going on in society than us beating each other up, killing each other, tearing down each other. Like, we already got so many other things counting against us, y'all. Can we please stand up and be united as a front? For real. Like, because they are going to continue to use that against us. They're going to continue to use that against us. Okay. So if you, I'm talking to any and everybody and anybody who want to share it. If you want to go and hurt somebody today, I promise you, take a second thought, take a deep breath, and look at these other countries. That's what's going on in their country. People are living off of a fraction of what we make in a day. Like, go visit a couple of places and really know what a real problem is. We ain't got that many real problems in the United States. I'm just saying, we really don't. Go visit some countries that's like living off of a quarter a day, so you can get a perspective of what's really going on in this world. We ain't got it that bad. All right, y'all. And if y'all don't like y'all situation, do something about it. Don't ask somebody else to do it. You go head out in there and do it yourself. Like, ain't nobody going to wait. Listen, nothing's going to be handed to you, especially if you ain't come from that kind of family. Nothing's going to be handed. You got to go and get it yourself. All right. I'm off my soapbox. All right. The last one is PTSD. That's post-traumatic stress disorder, most commonly known as PTSD. It's caused by being exposed to trauma, which is treatable, which is a treatable condition, and a lot of people successfully manage it. So symptoms that comes from PTSD usually take about 3 months to surface, which I don't think I knew exactly that time frame, which is very interesting. And what they say is that symptoms can include like vivid flashbacks. So think about people that was in like wars, that keep on hearing like, what happened in the war, or avoidance of the situation or place that reminds them of the individual of the event, and having trouble recalling the experience altogether. So traumatizing events, y'all, doesn't have to be extreme as like a war, right? But even like, sexual assault or a robbery or seeing something happen is traumatic too. So people know me. I will avoid seeing something if I do not have to see it, because it's traumatizing. Like, if something had it was gunshots in the back of my house before, like for a long time, any kind of bang would remind me of that. Like, so I try not to. You got to protect your ear gates and your eye gates, y'all. All right. So, but anyway, that's going on another tangent too. But anyway, so those things can be traumatizing, being a witness to something, right? So something that doesn't necessarily have to happen to you, or they said avoiding the spot that it happened at. So, real people telling you like, you know what, I don't even go there anymore. Like that just it triggers me. Right. That's our big word now. It triggers me. Or even certain smells or certain people that look like certain people, like people really have. And if we don't get it treated, it can keep, manifesting in other ways. So in ways to, treat both depression and PTSD is we have medicine for that. But we also, team it up with psychotherapy as well. And if y'all have any questions, just drop them in the chat too. I'm sorry, I don't think I opened up the floor. Please drop them in the chat. And so I just wanted to come on here to basically expose mental health for what it is. We are controlled by our brains, if you know it or not. So, and it's a pretty important organ in our bodies, and it controls everything that goes on. Okay. So why separate the two? It is the same thing, y'all. We have to check in mentally and physically. So just like you have a primary care provider, or you have whatever, if you have any other illnesses that's going on that you have to check in, you have to check in mentally. It's very necessary. I promise y'all. I didn't realize a couple of things about myself, and I was like, Yeah, like, like it's good to know. Just like somebody taking the blood pressure, like, oh, I didn't know I had high blood pressure, so I didn't know I had PTSD. I didn't know I was anxious. I thought that was normal. Everybody in my family do it, because honestly, it can run in families, because this is how my family handles things. So I'm just going to be anxious along with them, right? But guarding your health is all about breaking generational curses and really trying to do the best that we can for the generations to come. So if anxiety or depression or any kind of traumatic experiences run in your family, you'll be the first one to break the cycle. You be the first one that really go and get some help and tell everybody else about it so they can go get help too. Okay. And what else did I want to say? So yeah, it's breaking the stigma that, all crazy people go to seek psych. I tell my patients all the time, I'm like, we got to do better. And they know exactly what I'm talking about. Like, we got to do better. Okay. Like, if you having a problem, then go get the problem. The other thing that I did want to mention, I'm glad I brought that. Thought about it. Thank you, Holy Ghost. We have to stop self-medicating. So you find yourself having to turn to some kind of substance in order to cope. Think about it. So a rule of mine is that I make sure I am completely okay. I do a complete mental check before I have a beverage, an adult beverage, because I don't ever want to use it for that. I don't want to ever use it to cope with something. I always want to use it because it's, this is something that I just want, or it goes with my meal or whatever. But please, y'all, please do a mental check before you go and use a substance, because if you're using it to cope, now, don't get me wrong, I believe in medical marijuana. I am not a prescriber of it, but I do know that they have good benefits to it, and I believe in that wholeheartedly. I think of it as a medication, right? But if you find yourself, you can't wake up, or you can't get through your day, and I'm going all the way to like narcotics or cocaine or anything like that, it's another mental diagnosis connected to that. And it may not be as deep as like, schizophrenia or anything like that, but a mental diagnosis is a mental diagnosis. So that is my spiel, y'all. So any questions for me? Any questions? Thank you guys for coming on. Any questions? But yeah, I just want to encourage y'all to definitely go seek. If y'all lost anybody over the pandemic, or, before the pandemic, because grief can last long too, go get some help. Go talk to somebody. And honestly, people like, oh, I have my my church folks. Y'all know I'm a woman of God. Jesus is my savior, right? I still go to a therapist. It's still a mental check. It's still a mental check, period. You need your spiritual check and you need your mental check. Okay, so I believe in, or people like, oh, I'm going to go talk to my family members. They're grieving too, like, and don't get me wrong, like, it's okay to be as one, and supporting each other, but it's nothing like having somebody that's outside of your family looking in to see how they can definitely help you out. So I definitely suggest that. So, and then like y'all are pouring into each other and not really being completely poured into, because, y'all experiencing the same grief, So somebody said that they need a mental check. Yeah. Any questions, y'all? I know the Sixers play tonight. So I'm gonna go Sixers. All right, y'all. I love y'all. Next week, we are going to have our travel agent on. And this is one of the things that you can do for self-care and, try to break up, what's going on as far as mentally, doing some self-care things, and traveling is one of them. Traveling is one of them. So stay tuned, and I hope to see y'all soon. Any questions? We good? We're good? Thank you so much for coming on. I appreciate y'all. Love y'all, and I'll see y'all next week. Mwah.